Assalamu alaikum warahmatullahi wabarakatuh. Today I'm gonna explain something about acromegaly. So acromegaly is a chronic metabolic disorder in which there is a high production in growth hormone. So we can call acromegaly in other terms as a somatotroph adenoma or pituitary giant. And here we can see the patient with acromegaly, big hand, big feet, abnormal than the others, like really big Y. So the acromegaly occurs in about 6 of every 100,000 adults. It is caused by abnormal production of growth hormone after the skeleton and other organs is finished growing. So it actually occurs in the age of 20, 21, so in this age and up to end of life. An excessive production of growth hormone in children is called gigantism rather than the acromegaly. So the cause of it's due to increased production of growth hormone by the anterior pituitary gland. Due to most commonly is due to benign tumors, benign cancers, non-cancerous tumors called adenoma. So that lead to abnormal production of the growth hormone and maybe other hormones of the anterior pituitary gland, including prolactin. How we can have a hyperprolactinemia in this case, and other like hormones affecting the or secreted by the anterior pituitary gland. So we go on physiology. So we can see here is the pituitary gland, the anterior part, posterior part, and the infundibulum of the hypothalamus, and here's the hypothalamus. So this located on the base of the brain, the pituitary gland, and we can see a hypothalamus secrete the growth hormone releasing hormone, then goes to the anterior pituitary gland. In the anterior pituitary gland, the synthesis of the growth hormone and secretion occurs. And there is a lot of things depends on the production of growth hormone. So actually, growth hormone releasing hormone or growth hormone is secreted when it's modulated by many factors, including some things that we do daily or we experience daily, like stress, exercise, nutrition, sleep. And however, there is a primary controller for the growth hormone. These are growth hormone releasing hormone, which is secreted by the hypothalamus, and there is other hormone that increase secretion of a growth hormone, which is the ghrelin. Why ghrelin? Because the ghrelin has it's a peptide secreted by the stomach, and the ghrelins bind to receptors that actually stimulate secretion of a growth hormone. And there is two other hormones like somatostatin. So somatostatin is a hormone or peptide also produced by the hypothalamus, and its function to inhibit the growth hormone releasing hormone secretion, so that we will not have the growth hormone after that. So another thing is insulin-like growth hormone 1. So this hormone is secreted by the liver, and when we have a high amount of insulin-like growth hormone 1, we will see a decreased production of growth hormone from the anterior pituitary gland. So, and the insulin-like growth hormone is considered as a growth hormone receptor antagonist. Okay, so that's it. We go on the next symptoms. So main symptoms include the big extremities and sexual dysfunction, hormonal problems, and cardiomegaly, including hypertension, maybe some lung diseases. the galacturia prolactin production due to prolactin in females, especially because of hyperprolactinemia, and we have a hypertrophy of sweet or sebaceous gland. Even the skin becomes thick, and if we do an X-ray for the spine, we can see abnormal growth of the bones, and we can see large nose, jaw, teeth, and especially large lower jaw, and we can see some visual defects. Okay, and in females we can see abnormal growth of hair, and in general we can see like the patient is increasing weight. So there is some change of normal glucose tolerance test and fasting plasma glucose. We gotta see some change in the test result. And if we want to diagnose, so we can use for diagnose we can get the test for the insulin-like growth hormone and growth hormone itself for diagnosis, and for other like techniques, so we can see the CT or MRI for the brain to see if there is any non-cancerous or adenomas in the pituitary gland, and we can make X-ray, as I mentioned, to see the abnormal growth of the spine. So, and other investigations include the echocardiogram. We can see leaky mitral valve or leaky aortic valve. That's it for the diagnosis, so we can go for treatment. So for treatment, the picture showing the big hand, big face, big lower jaw. Okay, so treatment is, if there is a benign tumor, so surgery is indicated. So removing the tumor will give a good result, and the result also depends on the surgeon. Depends on the surgeon experience and the size of tumor, and the prognosis is good. And if the surgery is contraindicated, so radiation therapy. But for radiation therapy, the growth hormone slowly decreased after radiation therapy, very slowly decrease of the growth hormone. So, and there is a pharmaceutical treatment. So the pharmaceutical treatment included some drugs that control growth hormone release in some people. This include bromocriptine and some other drugs that block the effect of growth hormone, and this has been shown to improve symptoms of acromegaly. This drug like picovismant. So the medication is used before surgery or when the surgery cannot be like, no, it's not possible to do the surgery, so we use the pharmaceutical treatment. So after the treatment or removing of the adenoma, the patient should periodically come to the hospital to do them checks of the growth hormone, even to check the tumor of the pituitary, and that depends on the size of tumor, so, and the experience of the surgeon. So mostly it's pituitary surgery is successful in most patients, and the prognosis is good. And if the patient is not treated, we will see some complications, some bad complications actually. These include mainly diabetes mellitus, and due to the pancreas impairment of beta cell, we can see a cardiovascular disease. We can see carpal tunnel syndrome because of abnormal growth of the bones would lead to the compression of the nerves there. And we can see hypopituitarism, high blood pressure, glucose intolerance, as I mentioned, in diabetes, and we can see vision abnormalities and colonic polyps. And okay, thank you for your watching, and see you next time. Bye.